Notice: the people appearing in the video are for illustrative purposes only. They may not be real doctors or patients. Thank you. Hey everyone, welcome back to my channel. Today, we're diving into a topic that's incredibly important, especially if you're a sports enthusiast or interested in brain health. We're talking about chronic traumatic encephalopathy, commonly known as CTE. Now, you might be wondering, what exactly is CTE? It's a progressive brain condition that's believed to be caused by repeated blows to the head. Yes, those hard hits and concussions can have long-term effects. Chronic traumatic encephalopathy, CTE, is a progressive degenerative brain disease that has become increasingly recognized in the medical and sports communities. This condition is particularly associated with individuals who have a history of repetitive brain trauma, including concussions and subconcussive hits to the head. CTE has been most commonly identified in athletes involved in contact sports such as football, boxing, rugby, and hockey, as well as military veterans. Historical context and discovery. The origins of CTE date back to the 1920s when it was first described as punch-drunk syndrome in boxers. These athletes were observed to have symptoms like confusion, tremors, and speech problems after years of fighting. Dr. Harrison Martland, an American pathologist, was one of the first to describe this condition in a 1928 medical journal. However, it wasn't until the early 2000s that the broader implications of repetitive brain trauma began to be understood, largely through the work of Dr. Bennett Omalu, who identified CTE in a former NFL player. Pathophysiology. CTE is characterized by the buildup of an abnormal protein called tau, which can disrupt normal brain function and lead to a variety of symptoms. This tau protein accumulation is similar to other neurodegenerative diseases, like Alzheimer's, but the pattern of deposition in CTE is unique. The disease is thought to result from repetitive head trauma, which causes a cascade of neurological and biological changes in the brain. These changes can continue to develop years after the individual has stopped experiencing head impacts. Clinical features and symptoms. CTE can manifest in a variety of symptoms, which can be categorized broadly into cognitive, behavioral, mood, and motor abnormalities. These include memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, anxiety, Parkinsonism, and, in some cases, progressive dementia. It's important to note that these symptoms can overlap with other conditions, making CTE challenging to diagnose definitively during a patient's lifetime. Diagnosis and challenges. Currently, a definitive diagnosis of CTE can only be made post-mortem through neuropathological examination. Researchers are working on developing biomarkers and imaging techniques to diagnose the condition in living individuals. The lack of a definitive clinical test for CTE poses significant challenges for diagnosis and research. Symptoms can often resemble other neurodegenerative diseases, leading to misdiagnosis. Epidemiology. The exact prevalence of CTE is unknown, largely due to the current limitations in diagnosis. Most of the documented cases have been found in individuals with a history of repetitive brain trauma, particularly athletes in contact sports and military veterans. However, not everyone who experiences repeated brain trauma develops CTE, suggesting that other factors, including genetics, may play a role. Public health and safety concerns. The growing awareness of CTE has raised significant concerns about the safety of contact sports and military practices. It has led to increased scrutiny of sports organizations regarding how they handle concussions and their long-term implications. In response, there have been changes in rules and protocols to reduce the risk of brain injuries, along with improved helmet designs and other protective equipment. Treatment and management. Despite increasing awareness and research efforts, the treatment for CTE remains a challenging aspect due to its complex nature and the current inability to definitively diagnose the condition in living individuals. Understanding the challenges in treatment. The primary challenge in treating CTE lies in its diagnosis, which can only be confirmed post-mortem through neuropathological analysis. This limitation significantly hinders the development of specific treatments for CTE, as it is challenging to measure the effectiveness of potential therapies without a definitive diagnosis. Furthermore, the symptoms of CTE, such as cognitive impairment, mood disorders, and behavioral changes, overlap with other neurodegenerative diseases, complicating the clinical approach to treatment. Current therapeutic approaches. Given these constraints, The current treatment strategies for CTE are symptomatic and supportive, focusing on alleviating the specific symptoms experienced by the individual. Cognitive symptoms. For cognitive impairments, such as memory loss and executive dysfunction, treatments may include cognitive rehabilitation therapies. These therapies aim to improve cognitive function through exercises and tasks designed to enhance memory, attention, and problem-solving skills. Mood and behavioral disorders. Mood symptoms like depression, anxiety, and irritability, often associated with CTE, are usually managed with a combination of pharmacotherapy and psychotherapy. Antidepressants, mood stabilizers, and anti-anxiety medications can be prescribed based on individual needs. Psychotherapy, including cognitive behavioral therapy, CBT, can help individuals develop coping strategies and manage the emotional and psychological aspects of the condition. Physical symptoms. Physical symptoms such as headaches and motor problems can be addressed through medications, physical therapy, and occupational therapy. These therapies can help maintain mobility and function, reduce pain, and improve the overall quality of life. Lifestyle modifications. Encouraging a healthy lifestyle is a vital component of managing CTE. This includes regular physical exercise, a balanced diet, adequate sleep, and cognitive activities that stimulate the brain. Avoiding substances that can exacerbate symptoms, like alcohol and drugs, is also crucial. Research and future directions. There is ongoing research to better understand the pathophysiology of CTE and develop targeted treatments. Efforts are focused on identifying biomarkers and imaging techniques for early and accurate diagnosis, which could open the door to disease-modifying therapies. Neuroprotective strategies. Researchers are exploring medications and interventions that could protect brain cells from damage due to repetitive head impacts. Anti-tau therapies. Since the accumulation of tau protein is a hallmark of CTE, treatments aimed at preventing tau accumulation or promoting its clearance from the brain are under investigation. Stem cell therapy. Experimental approaches like stem cell therapy are being explored for their potential to regenerate or repair damaged brain tissue. Ethical and legal implications. The recognition of CTE has led to ethical debates in the realms of sports and military service. Questions about informed consent, the risks associated with certain careers, and the responsibilities of organizations to protect their members are central to these discussions. Additionally, there have been legal implications, with lawsuits filed by athletes and their families against sports leagues and organizations. Conclusion. Chronic traumatic encephalopathy represents a significant challenge in the fields of neurology, sports medicine, and public health. While much progress has been made in understanding this condition, there is still much to learn about its causes, progression, and management. As awareness of CTE increases, it is hoped that this will lead to improved safety measures, better diagnostic tools, and ultimately, effective treatments for those affected. The ongoing research and evolving conversation around CTE underscore the critical need for continued attention and resources dedicated to addressing this complex and impactful condition. And that's a wrap for today's video. Thank you so much for watching. If you found it helpful, please give it a thumbs up. Don't forget to subscribe and hit that bell icon so you won't miss any of our upcoming content.